two main types of heart treatment. One is a valve replacement. Another one is precision angioplasty. Next slide, please. So I was talking about the valve problem, which is called aortic valve stenosis. So it is one of the most common type of valve problem. Commonly, as the age increases, the risk of this valve problem increases. So common age group is patients more than 60 years of age. In younger ages, we have higher chances of blockage formation in the arteries leading to heart attack. But as we grow older, we have chances of valve getting narrowed. Next slide, please. As the valve becomes narrow, the whole blood from the heart should go to the body, has to go through this valve. So when the valve becomes narrow, the blood cannot go easily as normally it can. So that is when people start suffering health issues, mainly in the form of giddiness, falling unconscious, developing chest pain, and also developing problems like breathing difficulty. So that is when we recognize by preliminary investigations that the person has developed a valve issue, and that needs to be treated. And now we have options where it can be performed without a surgery. Next slide, please. A video to help understand how a narrow valve looks. A normal valve is able to open in a complete manner. However, a narrow valve cannot open the way normally it can. So you can see the valve is narrow, now it cannot open normal fashion. Unfortunately, this type of problems cannot be treated by giving any medication. There are no medications which can help improve the valve movement. That is when you need to replace the valve with an artificial one. Next slide, please. So, as I mentioned, the most common age group is the age group more than 60 years. Next slide, please. So, I mentioned about two options available. One is the conventional open surgical procedure called, which is SAVR, surgical aortic valve replacement. But now we have an option to replace the valve without performing a surgery. The way how you perform an angioplasty, you can replace the valve also. It is called TAVI, transcatheter aortic valve implantation. Aged more than 65 years. So anybody who is aged more than 65 years for this transcatheter aortic valve replacement, meaning valve replacement without opening the chest of the person. Next slide, please. We make a small hole. All these things are performed in a person who is conscious. They are not put into complete sleep. The person is conscious. In a conscious person, this procedure is performed. And we don't have to even make the person unconscious. The person doesn't need any ventilator support. It can be performed under local anesthesia. Like how you give a small injection and remove a tooth. Similarly, you can give a small injection to make the area numb and go ahead and replace the valve. There are various access points through which you can perform the procedure, either from the neck or from the groin. Sometimes you can also perform from the hand also. Next slide, please. So, every procedure has its own complications and adverse outcomes. When you compare with conventional way, which is by means of a surgery, so this procedure has less complications compared to that of a surgery, because the person needs ICU care after a surgery, but here in this, the person does not need ICU care. The person can be discharged as soon as 2 to 3 days from the hospital. The person undergoes a valve replacement and he may go home third day. But in the TAVR procedure, or the person can resume their normal daily routine in as soon as 1 week. So it is a greatest advantage that the person can become socially active, resume their work, go to office and their work in as soon as 1 week, even after undergoing such a major surgical procedure like a valve replacement. Next slide please. Right here, he is the French doctor who first innovated this procedure in the year 2002, and by 2011 it has become widely available and approved for human use. French doctor who first discovered or devised this procedure. Next slide please. Next slide. First time was started in 2002. Over next 9 years of progressive development, it became suitable for safe performance of the procedure in humans. And initially, it was performed in only very high risk, critically ill patients. But as the technology evolved, as the results became better and better, it became available even to the low risk patients, meaning almost anyone who has aortic valve stenosis are suitable to undergo this surgical procedure. Next slide please. A procedure can be performed that the patient can go home in as soon as 3 days, and their 30-day outcome or long-term outcome are as good as the conventional surgery. Size and shape of the valve. So these are mounted on a balloon and then they are passed from the groin to the heart, and there we deploy these valves. So there are valves from different companies which are either made up of pericardium or the bovine pericardium or the cow pericardium. So these valves are constructed from this material and they are used for replacing the deceased. A small video to help us understand about this procedure. It is not a surgery, it is a minimally invasive procedure, and there is no general anesthesia required, and you will not make the heart stop like how you do in conventional surgery, where the beating heart is stopped and then the surgery is performed. However, in this you perform in a conscious person under local anesthesia. So this is how we insert a small tube in the groin of the person, and then we load the valve on the balloon and send it to the heart, and after reaching the correct location you deploy the valve. Now you are expanding the valve with a balloon to create some space, and now this is the valve. It comes crimped on a balloon. First we crimp it on a balloon outside the body, then we take it inside, and then you expand the valve. Now this new normal functioning valve sits in the place of the deceased valve. Now you have a normally working valve taking over the function from the same day, and by third day they are stable and fit enough to go home. Next slide please. Like, these are real human body images. Earlier we saw an animation, now we see the real images. Going to be expanded. X-ray images. This is under X-ray these procedures are performed in a conscious person. Next slide please. From the surgical valve replacement, which is the conventional way of surgery. So it is a minimally invasive procedure. You make a small hole instead of a major cut on the chest of the person, and here you don't make the heart stop beating. It is performed in a beating heart, and you don't require a heart-lung machine or the cardiopulmonary bypass. So without a bypass, you can perform a valve replacement procedure. And this is done under local anesthesia like how you remove a tooth. The whole procedure takes about 1 to 2 hours. However, on the contrary, in an open surgical procedure, it takes anywhere up to 3 to 5 hours. And patient can go home either in 1 to 3 days when you perform a minimally invasive valve replacement. However, patients remain in the hospital for 5 to 10 days for recovery in the conventional method. And the pain after the procedure is very mild in a minimally invasive valve replacement. However, they continue to suffer from pain for an extended period, anywhere up to 2 weeks or even more. And the body will not have a scar when you perform a minimally invasive replacement. However, you all might have seen in your friends, neighbors, relatives, big scar on the chest when you perform a open surgical procedure. So this disadvantage is not there when you perform a TAVI procedure. Procedures which are again minimally invasive. These are also performed without a open surgery but a small hole in the groin. Next slide please. The function of a valve is to make the blood flow in one direction, but when the valve is diseased, it stops functioning and it starts leaking, leading to backflow of the blood. We can put a clip joining both the leaflets of the valve so that the backflow is prevented. So conventionally, these procedures are done earlier with the open chest, but now it can be performed through a small hole in the groin. Next slide please.